Walter Hobbs arrives at the emergency department in heavy shackles, escorted by armed prison guards. He is a convicted murderer who just survived a botched lethal injection. The executioners missed his veins, leaving the toxic chemicals trapped in his muscle tissue. His arm is hard to the touch, doctors diagnose him with acute compartment syndrome, and perform an immediate fasciotomy to relieve the internal pressure. The ethical reality surfaces quickly. Hobbs murdered a family of 5, and the state demands he be kept alive only so they can execute him again. The death warrant has already been extended. The medical team is ordered to repair a man for the sole purpose of his legal killing. The situation worsens as the necrosis spreads beyond his arm and infiltrates his chest cavity. In the operating room, the patient's blood pressure collapses. Surgeons find the axillary artery torn and retracted deep into the chest. They struggle to clamp the vessel as blood saturates the surgical drapes. The monitor alarms. The heart rate drops to 20 beats per minute before flatlining. The surgeons realize the futility of the procedure, they stop their efforts, and step away from the table. There are no more pulses. The lead surgeon looks at the wall clock and records the official time of death as 16:22. The state's second attempt at execution becomes unnecessary. The medical mission ends in a silent room filled with the smell of blood and failed chemicals. Hollywood action star Rupert Payne joins rookie officer John Nolan for a ride-along. He is looking for real inspiration for his next movie franchise. The arrogance is immediate. When they respond to a domestic disturbance involving a man with a knife, Rupert doesn't see a tragedy, he sees a scene. He pulls out his phone to record the victim's breakdown, treating human suffering as a prop for his next script. Rupert attempts to solve the crisis with a checkbook. He offers the man's brother, Malcolm, a large sum of money for a private care facility. To Rupert, it is a generous donation. To Malcolm, it is a humiliating insult from a man who understands nothing of their struggle. The tension boils over. Later that day, Malcolm and his friends track Rupert to the movie studio. They break into his office, kidnap him at gunpoint, and demand access to his safe. Nolan loses contact with the star, but utilizes the police dispatch system. The coordination network tracks Rupert's movements and directs units to the studio lot with precision. Nolan arrives just as the kidnappers attempt to move their hostage. A real shootout breaks out. There are no stunt doubles or blanks. Rupert takes a live round to the abdomen. The Hollywood hero collapses, screaming in genuine terror. As Nolan secures the scene and paramedics stabilize the wound, the reality sets in. Rupert realizes that in the real world, fame provides no armor, and the police work he mocked is the only thing keeping him alive. Sergeant Gray calls Tim into his office to deliver a single fact. Detectives made a drug bust this morning, and the suspect is Tim's wife, Isabel. The charge is possession with intent to sell. Tim enters the interrogation room to find a woman he barely recognizes. Isabel is disheveled, trembling from withdrawal, and desperate. Tim accesses the police database to verify the details of her arrest. He discovers the vehicle she was driving is registered to Carson Hall, a known drug kingpin. When confronted, Isabel admits the relationship. She reveals a kilo of heroin is hidden inside her apartment's heating unit. She tells Tim a search warrant will be executed tomorrow morning. She begs him to go to the apartment and remove the drugs before his colleagues find them. She plays on his fear, stating that if she goes to prison, her past as a police officer will be discovered and she will be killed. Tim stands under the gaze of the interrogation room recording system. He listens to her pleas for a backroom deal and a clean slate. He realizes she is no longer an officer undercover. She is a trafficker facing 20 years. Despite the history between them, Tim refuses to move. He watches as Isabel is handcuffed and transferred to county lockup. He remains in the room, his career intact, and his marriage dead. The recording system captures the finality of his choice as he walks out, leaving the addict behind to face the law. Sergeant Gray calls Tim into his office to deliver a single fact. Detectives made a drug bust this morning, and the suspect is Tim's wife, Isabel. The charge is possession with intent to sell. Tim enters the interrogation room to find a woman he barely recognizes. Isabel is disheveled, trembling from withdrawal, and desperate. Tim accesses the police database to verify the details of her arrest. He discovers the vehicle she was driving is registered to Carson Hall, a known drug kingpin. When confronted, Isabel admits the relationship. She reveals a kilo of heroin is hidden inside her apartment's heating unit. She tells Tim a search warrant will be executed tomorrow morning. She begs him to go to the apartment and remove the drugs before his colleagues find them. She plays on his fear, stating that if she goes to prison, her past as a police officer will be discovered and she will be killed. Tim stands under the gaze of the interrogation room recording system. He listens to her pleas for a backroom deal and a clean slate. He realizes she is no longer an officer undercover. She is a trafficker facing 20 years. Despite the history between them, Tim refuses to move. He watches as Isabel is handcuffed and transferred to county lockup. He remains in the room, his career intact, and his marriage dead. The recording system captures the finality of his choice as he walks out, leaving the addict behind to face the law. Denise enters the hospital with a bleeding lip and a swollen face. Maggie, the head nurse, sees the injuries and immediately identifies the source. Denise refuses medical help and defends her boyfriend, Trevor. She insists the violence was her fault and claims Trevor is the only person who truly loves her. Maggie realizes logic will not break this cycle of manipulation. She leaves the hospital and drives to the car lot where Trevor works. Maggie confronts Trevor in public. She stands her ground as he tries to charm his way out of the situation. She informs him that any further contact with Denise will result in an immediate police report. Trevor drops the act and calls Denise a drama queen. He shows no remorse, only irritation that his prey is being protected. Maggie stares him down until he backs away. He is a predator who fears consequences more than he values Denise. Maggie returns to the hospital room. She looks at her sister and delivers a calculated lie. She tells Denise that Trevor fled the moment he was confronted. She claims he admitted he never loved her and left without looking back. Denise breaks down, screaming that Maggie has destroyed her only relationship. She tells Maggie she hates her. Maggie remains silent and accepts the resentment. She has traded her sister's affection for her sister's life. The toxic connection is severed through a brutal, necessary deception. 14-year-old Matt Jacobson arrives at the emergency room with a shattered left forearm. Dr. Connor Rhodes examines the injury and immediately disputes the cause. The fracture pattern does not match a fall from a skateboard. Rhodes smells alcohol on the father's breath and notes his visible agitation. He concludes this is a case of domestic battery used to harvest opioids. Rhodes orders a social work evaluation and prepares to involve Child Protective Services to isolate the boy from his father. He confronts the man in a private room, accusing him of abusing his son and stealing his medication. The situation shifts when the toxicology report returns. Matt's system is completely clean. He has not ingested any of the hydrocodone prescribed to him. Rhodes enters the hospital room to finalize the report to the authorities, but Matt interrupts. The boy admits he slammed his own arm in a heavy door on purpose. He did it to secure a prescription for his father. A car wreck 10 years ago left the man with chronic back pain, but recent CDC guidelines abruptly cut off his legal access to oxycodone. Without a prescription, the father turned to alcohol to manage the withdrawal and the pain. Matt watched his father suffer and decided to trade his own physical safety for his father's relief. The accusations of abuse collapse into a reality of desperation. Rhodes realizes he misidentified a sacrifice as a crime. He cancels the call to child services and provides a referral to a specialist. The case ends not with an arrest, but with a doctor standing in the silence of his own error. Desiree collapses at the hospital entrance as a violent seizure takes hold. A CT scan confirms the worst. Her ovarian cancer has metastasized to her brain. A large tumor sits on her right temporal lobe. Doctors recommend an immediate craniotomy, but Desiree refuses. She is pregnant with a son named Elijah. She knows general anesthesia risks the baby's life, and she chooses his safety over her own. Her condition spirals. A second seizure strikes, her right pupil dilates, and brain swelling begins. She is intubated and placed on a ventilator. Caleb, her husband and legal surrogate, panics and demands the surgery. He cannot face losing her. Dr. Charles presents a cold ultimatum. Without the operation, Desiree will never wake up. The alternative is to use steroids to manage the brain swelling, keeping her body alive on life support just long enough to reach a viable delivery date. Caleb realizes this would turn his wife into a human incubator. He struggles with the weight of the decision, recalling their years together since college. He sees the machines breathing for her and the doctors waiting to wheel her to the operating room. In the final moment, Caleb stops the team. He withdraws his consent for the surgery. He chooses to respect Desiree's original wish and her maternal sacrifice. He lets go of the woman he loves to protect the son she died to save. Desiree collapses at the hospital entrance as a violent seizure takes hold. A CT scan confirms the worst. Her ovarian cancer has metastasized to her brain. A large tumor sits on her right temporal lobe. Doctors recommend an immediate craniotomy, but Desiree refuses. She is pregnant with a son named Elijah. She knows general anesthesia risks the baby's life, and she chooses his safety over her own. Her condition spirals. A second seizure strikes, her right pupil dilates, and brain swelling begins. She is intubated and placed on a ventilator. Caleb, her husband and legal surrogate, panics and demands the surgery. He cannot face losing her. Dr. Charles presents a cold ultimatum. Without the operation, Desiree will never wake up. The alternative is to use steroids to manage the brain swelling, keeping her body alive on life support just long enough to reach a viable delivery date. Caleb realizes this would turn his wife into a human incubator. He struggles with the weight of the decision, recalling their years together since college. He sees the machines breathing for her and the doctors waiting to wheel her to the operating room. In the final moment, Caleb stops the team. He withdraws his consent for the surgery. He chooses to respect Desiree's original wish and her maternal sacrifice. He lets go of the woman he loves to protect the son she died to save. A passerby finds an unconscious 8-month-old baby locked inside a car in the hospital parking garage. Medical teams rush the infant to the emergency room to treat severe dehydration and hypothermia. The mother is identified as Gwen, the hospital's chief administrative officer. Gwen is currently in a custody battle with her husband. She knows that a record of this negligence will cost her the child. She corners the lead physician, Dr. Manning, and demands a cover-up. Gwen tells Manning to omit the car incident from the official medical report. When Manning hesitates, Gwen reminds her who controls the hospital's budget. Manning ignores the threat. When Gwen's husband arrives, demanding to know how his son was injured, Manning tells him the truth. She confirms that Gwen left the child in the vehicle while she went to work. The husband leaves to call his lawyers, stating Gwen will never have access to the boy again. Gwen intercepts Manning in the hospital corridor. She does not mention her son's health. Instead, she uses her executive power to retaliate. She informs Manning that the Community Health Clinic project, a long-term medical initiative for the local neighborhood, is now terminated. Gwen signs the paperwork to withdraw all funding immediately. She tells Manning that since her family is gone, the project is gone too. The administrative authority of the hospital is turned into a weapon for personal revenge, shutting down a public health service to punish a doctor who spoke the truth. Layla goes into labor in the wreckage of a plane crash. Paramedics deliver the infant on a stretcher while the site is still smoldering. The baby, Maisie, suffers from immediate respiratory failure and is rushed to the neonatal intensive care unit. Doctors stabilize her using an ECMO machine, but she requires an urgent lung transplant to survive. The medical team tests the parents, Layla and Patrick, to find a donor match. The results return with a clinical anomaly. Patrick is not the biological father, and Layla is not the biological mother. An investigation into their IVF history reveals a catastrophic error at the fertility clinic. Two couples with the same last name, Starkey, had their embryos swapped during the implantation process. Layla has spent 9 months carrying a child that belongs to strangers. In the hospital corridor, she confronts Denise and Steve, the biological parents of the infant in the incubator. The revelation creates a secondary crisis. Denise is currently pregnant with Layla's biological child. The two families stand in the NICU, separated by a glass wall and a laboratory mistake. Steve is a match for the transplant, but the infant needs a second donor. Despite the lack of a genetic connection, Layla refuses to walk away. She signs the surgical consent forms immediately. She chooses to undergo a major operation to donate a lobe of her lung to the baby she delivered. To Layla, the physical bond of pregnancy supersedes the DNA report. She enters the operating room to save a life that isn't hers. Gary lies in a hospital bed, his leukemia advancing. The transplant is canceled because the donor has a fever of 100.3 degrees. Hospital policy is absolute. The cutoff is 99.9. Head nurse Maggie knows Gary does not have another week. His heart rhythm is failing. A bus crash floods the emergency department with victims and their families. Maggie ignores the triage orders. She sets up a blood collection station in the waiting room. She tells every family member they must be screened for the Marrowmatch database. The hospital director orders her to stop, citing the strain on the staff. Maggie continues to draw blood. She gathers dozens of samples from the crowd. In the intensive care unit, Gary's monitor emits a steady tone. His heart stops. Doctors use a defibrillator, charging it to 200 joules. Maggie watches the computer screen as it processes the final batch of blood data. The doctors shock Gary's chest. The screen remains red. They shock him again. At the exact moment the lead doctor prepares to call the time of death, the computer screen flashes green. A match is found. Gary is pronounced dead at 17:36. Maggie stands in silence. Later, a lab technician reveals the full results of her unauthorized screening. The data from the 40 people Maggie tested provides perfect matches for 40 different patients on the national transplant list. Gary is dead, but 40 terminal patients now have donors. Maggie walks through the lobby. One man's death has triggered 40 survivals. Brock arrives at the emergency room with severe multi-organ inflammation. He tells Dr. Ethan Choi he is a civilian mechanic currently between jobs. Ethan reviews the patient's medical file and finds an immediate discrepancy. Brock's history shows a series of vaccinations required only for international travel, yet Brock denies ever leaving the country. He claims his life has been limited to Chicago and the Georgia coast. The pressure mounts when Brock mentions his expertise with the Honeywell AGT-1500 engine. Ethan knows this specific engine powers the M1 Abrams main battle tank used by the 3rd Infantry Division at Fort Stewart. This unit frequently deploys to Africa, which explains the specific vaccinations in Brock's record. A COVID antibody test confirms the medical cause of the collapse, Miss A. This rare inflammatory syndrome is attacking Brock's internal organs months after a viral infection. Faced with these facts, Brock admits he is a deserter. He went AWOL after his physical strength vanished and his colleagues stopped trusting him. He fled his unit in the middle of the night because his body could no longer pull its weight. As a former military doctor, Ethan is expected to report the desertion to the military police. Nurse April Sexton watches as Ethan pulls out his phone, assuming he will follow protocol. Instead, Ethan provides Brock with the contact information for a military defense attorney. He chooses to treat the soldier's condition and protect his secret, recognizing that the man's flight was driven by a medical crisis rather than cowardice. Will and Vanessa are out of options. Their patient, Rose, is dying from a severe infection, and the hospital pharmacy is empty. They decide to break the law. They contact Devin, a street dealer, to purchase black market antibiotics. The transaction is fast and silent. Rose receives the medicine, but the consequences arrive at the emergency room sooner than expected. Devin is brought into the same hospital on a gurney. He is overdosed on cocaine, laced with PCP. The chemicals trigger a violent psychotic break. Devin leaps from the bed, screaming and swinging his fists at anyone in a white coat. He attacks the medical staff with unnatural strength. In the chaos, Dr. Dean is slammed against a wall and sustains a serious injury. Security eventually pins Devon down, but the violence brings the police. The hospital administration launches an immediate investigation. They discover the link between the doctors and the dealer. Detectives and board members fill the hallways, demanding records and statements. The career-ending truth is exposed. Will and Vanessa bought drugs from the man now restrained in their trauma bay. Maggie, the head nurse and Vanessa's biological mother, discovers the secret. She confronts Will in a quiet corner. There is no shouting, only a cold, factual warning. She tells him that his recklessness has jeopardized Vanessa's medical license and her future. She demands he never involve her daughter in his illegal schemes again. While the hospital avoids a criminal lawsuit to protect its reputation, the internal fallout is absolute. Will and Vanessa remain on staff, but the trust is gone. Every colleague watches them in silence. A train accident victim arrives with severe respiratory failure. Doctors confirm he inhaled hydrofluoric acid from leaking lithium batteries during the crash. The chemical has corroded his lung tissue beyond repair. He requires an immediate double lung transplant. The surgical team identifies a pair of donor lungs, but they are severely damaged from a car accident. Resuscitating them requires an ex vivo lung perfusion machine, but supply chain disruptions have left the hospital without the necessary equipment. Billionaire engineer Jack Dayton intervenes. He assembles a technical team to build a functional perfusion device using salvaged hospital parts. They extract arterial and venous tubing from a dialysis machine. They integrate pumps, gas exchangers, and oxygenators from an ECMO unit. To maintain temperature and sterility, they repurpose an infant incubator and plastic sheeting from an enclosure bank. The donor lungs arrive in a cooler, gray, and non-functional. The team connects the tissue to the makeshift device. For several hours, the machine pumps blood and oxygen through the lungs. The tissue turns pink as the perfusion process reverses the trauma. The lungs pass the functional test. Dr. Marcel performs the transplant, the patient's oxygen levels stabilize, the operation is a success. News of the improvised medical breakthrough reaches the public. Within hours, Dr. Marcel gains 30 million social media followers. Dayton warns him that the technical victory is over and the pressure of global fame has begun. Renee Chapman, an Abel Prize-winning mathematician, is admitted to the emergency room during a violent psychotic episode. Her behavior is erratic, and she is unable to recognize her surroundings. Doctors perform a CT scan to check for brain lesions or tumors, but the imaging shows no abnormalities. Dr. Charles investigates her recent medical history and identifies the cause, tacrolimus. This immunosuppressant, taken to protect her transplanted kidney, is triggering a rare and severe side effect of drug-induced schizophrenia. The medical team attempts to switch her to different medications, but Renee proves allergic to every alternative. The clinical reality is absolute. To keep the kidney, she must remain in a state of permanent psychosis. To regain her sanity, she must lose the organ. Her husband watches as his wife's intellect is erased by the very drug keeping her body alive. He decides that her mind is more valuable than her physical comfort. He issues a final instruction to the surgical team: remove the healthy kidney and return it to the National Donor Registry. He chooses to sacrifice her physical stability to restore her mental clarity, knowing she must return to a life of grueling dialysis. The surgeons perform the explant. As the medication leaves her bloodstream, the hallucinations vanish. Renee wakes up in the recovery ward. She is physically weak and once again dependent on a machine to filter her blood, but her eyes are focused. She recognizes her husband. The mathematician has surrendered her body to reclaim her mind. A 6-year-old inmate is rushed into the trauma bay with a deep laceration to the anterior lateral neck. Dr. Dean Archer looks at the patient and freezes. It is Sean Archer, his son, missing from his life for 15 years. The X-ray confirms a metallic fragment buried in the soft tissue near the carotid artery. Before Archer can process the shock, a second ambulance arrives. The patient is the man who stabbed Sean. He has sustained massive blunt trauma to the chest and back from a correction officer's baton. The prisoner's condition rapidly deteriorates. His breath sounds vanish on the left side, signaling a tension pneumothorax. Suddenly, his heart rate drops into the 40s before flatlining. Archer faces the man who nearly murdered his child. He does not hesitate. He demands a chest tube tray and orders 100 of fentanyl. Archer takes the scalpel and slices through the prisoner's ribs, performing an emergency bedside thoracotomy. He reaches into the open chest to manually compress the heart. The ventilator takes over the man's breathing. Archer applies internal paddles directly to the cardiac muscle, 50 joules. The heart quivers and then finds a steady rhythm. The attacker survives. Hours later, Archer stands in the ICU as the team prepares to extubate Sean. The tube is removed. Sean gasps for air and looks up at the father he hasn't seen in over a decade. The silence of 15 years ends with a single word. Archer places a hand on his son's forehead, the transition from surgeon back to father complete. Gloria enters the emergency room in a state of visible distress. She tells the medical staff she attended a warehouse party, consumed a single drink, and woke up in an unfamiliar room with her clothing missing. Doctors Hannah Asher and Nellie Cuevas move her to a private treatment area for a forensic examination. The lab results return positive for GHB, a powerful sedative used to incapacitate victims. Physical evidence confirms severe injuries and bruising consistent with sexual assault. Despite the medical findings, Gloria refuses to cooperate with the authorities. She refuses to provide her identification or insurance details. Her primary fear is not the attacker, but the police. As an undocumented immigrant, she believes a formal report will trigger a deportation process. She demands an immediate discharge, choosing to bury the crime rather than risk being removed from the country. Dr. Asher insists on a police report to prevent future attacks, but Dr. Cuevas recognizes the specific terror of the undocumented. In a private moment, Cuevas makes a choice that puts her own medical career at risk. She reveals to Gloria that she is also undocumented, living in the United States as a DACA recipient. She shares the same legal fragility and the same fear of the system. This admission of a shared secret changes the dynamic. Gloria realizes her doctor understands the stakes of being invisible. Empowered by this trust, Gloria agrees to meet with investigators and provide a formal statement. She stops her attempt to flee and begins the process of holding her assailant accountable. Lydia, 15, arrives at the emergency room confused and disoriented. Doctors Halstead and Liu examine her and find a significantly enlarged liver. The diagnosis is primary biliary cholangitis, an autoimmune disease that has triggered total liver failure. Her mother, Danielle, steps forward to donate a portion of her own liver without hesitation. However, the transplant committee issues a cold rejection. Danielle is a recovering alcoholic, and while she is sober now, her liver shows signs of mild fibrosis. The organ is medically unfit for donation. Desperate, the medical team looks for a loophole in the National Registry. They find Roberta, a patient who has spent 3 years waiting for a kidney. Her husband, Frank, is a healthy man willing to donate, but he is not a biological match for his wife. Halstead and Liu propose a trans-organ paired exchange. The plan is a high-stakes swap. Danielle will donate one of her healthy kidneys to Roberta, and in return, Frank will donate a lobe of his liver to Lydia. The risks are uneven. Liver surgery involves a massive abdominal incision and a much longer recovery time compared to a kidney extraction. Frank acknowledges the danger but chooses to proceed to save his wife. The legal and medical teams finalize the paperwork for this rare cross-family match. Following the successful operations, the two families meet for the first time in the recovery ward. Danielle and Roberta embrace, realizing that their survival depended entirely on a stranger's sacrifice. The exchange is complete, and Lydia is given a second chance at life. Jason arrives at the emergency room suffering from violent, unexplained seizures. His parents are paralyzed by a decade-old trauma. 12 years ago, their first son died from the exact same symptoms. No doctor could find the cause then, and history is repeating itself now. Conventional medical tests return normal results, leaving the emergency team with no answers as the boy's condition rapidly deteriorates. Dr. Song intervenes with a radical proposal. She intends to use a neural network to scan Jason's DNA against every known genetic database on the planet. While the human doctors guess at infections or environmental toxins, the AI begins comparing his genetic code to hundreds of thousands of documented mutations. Time runs out as Jason suffers another massive seizure. His brain is starving for oxygen. To buy the AI 1 hour of processing time, Dr. Halstead puts the boy into a medically induced coma. He paralyzes the child with drugs and connects him to a ventilator. The parents watch their son disappear behind tubes and monitors, convinced they are witnessing the same death they saw 12 years ago. The neural network completes its scan and identifies a mutation so rare it occurs in only 1 in a million people. Autosomal recessive thiamine metabolism, dysfunction syndrome 2, Jason's body cannot transport vitamin B1 to his brain. The mystery that killed his brother is revealed as a treatable metabolic defect. The solution is not a complex surgery, but a high-dose vitamin supplement. Technology solves in 60 minutes what human intuition failed to grasp for 12 years. Jason will survive. Marcus lies in a hospital bed with a shattered spine. Neurosurgeon Sam Abrams checks the electronic health records on his tablet. The data shows chronic hypertension, renal disease, and a platelet count below 100,000. Abrams refuses to operate. He states the medical risk is too high and he will not touch a patient who might bleed out on the table. Without this surgery, Marcus will remain paralyzed. Dr. Crockett Marcel reviews the patient's history and identifies a pattern of low platelets. He diagnoses Marcus with ITP, a condition where the body destroys its own platelets. Marcel knows a standard transfusion will fail. He decides to bypass hospital protocol. Without informing the primary surgeon, Marcel administers a high dose of steroids. The medication forces the platelet count to rise rapidly, creating a temporary spike in the system's data. Abrams sees the new numbers on the monitor. He believes the patient's condition has improved and proceeds with the surgery. The operation is successful and the spine is stabilized. However, Abrams becomes suspicious of the rapid recovery. He runs an antibody test and discovers the truth. Marcel manipulated the patient's chemistry to force the surgery under false pretenses. Abrams confronts the team in the hallway. He threatens to report the deception to hospital administration. Vanessa, the resident, realizes she was used as uses a shield. Marcel admits he acted alone to save the patient's life, claiming he was protecting Vanessa from the professional consequences. She refuses to accept his justification. She demands his respect, not his protection. Kara Wallace enters the emergency room 6 weeks after giving birth. She is 40 years old and exhausted. She reports persistent vomiting and nausea. Doctors find her blood pressure at 147/92. They initially suspect postpartum preeclampsia or simple exhaustion from caring for a newborn. Kara tries to describe her symptoms, but her speech suddenly breaks. She stares at the doctors, fully conscious but unable to form words. She has developed aphasia. Brain scans reveal a rare condition, Moyamoya disease. The name describes the puff of smoke appearance of tiny, fragile vessels forming where her main carotid arteries have narrowed. These compensatory vessels are prone to hemorrhaging. The medical team confirms Kara has already experienced multiple small strokes. They recommend a conservative approach using aspirin and calcium channel blockers to reduce future risks. They describe surgery as an invasive, high-risk neurosurgical procedure that should be delayed until she is stronger. Kara refuses the delay. She spent years trying to conceive through IVF and refuses to let a stroke define her time with her son. She views the medication as a temporary shield that could fail at any moment. She demands the surgery immediately. She wants the damaged vessels bypassed and the blood flow to her brain permanently restored. Despite the risk of brain damage or death on the operating table, she chooses the scalpel. She will not go home with a ticking clock in her head. The neurosurgery team is paged. Kara prepares for the operation